Welcome to Automation Caffeine, your dose of invigorating business automation tips packed as fun anecdotes and weird questions. We have a different guest every episode from various industries, countries, and backgrounds for a 20 to 30-minute talk over coffee or water. My name is Jesse. I'm co-founder of Trigger. I'm a serial entrepreneur, and above all, I'm a coffee snob. And today I am joined by David Sparks, head of regulatory affairs at MRI Guidance, and a good friend of mine. Hi, David.
Hi, Jesse. Thanks for the invite.
Yeah, you're welcome. I've been looking forward to this one for a while, but before we get started, for the live audience, if you have any questions to David, please add them in the comments to the event, and we'll pick them up at the end during our live Q&A. So David, as you know, we always get started with the three-word introduction. So who are you in 3 words?
That was a difficult one, but I managed to come up with a few. Analytical, competitive, and nit-picking. although I do like the Dutch words for that a bit better. Muggenzifter or mierenneuker.
Yeah. Yeah, for those who don't know that, yeah, in Dutch we call that an antfucker. And indeed that's, yeah. That is I have to say that is a little bit how I know you. What would you say sort of, because you're in regulatory affairs, I guess that those things come in quite handy, those traits.
Yeah, it's kind of in job applications we always put it down as an eye for detail, but yeah, you do have to be a bit nitpicky about like the rules that you follow.
Yeah. Yeah, that's a nice way to put it, an eye for detail. So David, for those who tune in and don't know exactly what MRI Guidance is or the main product that you have, Bone MRI, can you explain what the product does and how it leverages AI?
Yeah, so we're a software company. We make Bone MRI, which is a product that is used in a hospital setting. So in a hospital setting, patients often come in to the hospital when they come into the hospital for conditions of the spine. They normally get a few scans. They need to get an MRI scan to visualize all the soft tissue within the spinal cord and around the spine. And then they have to undergo a second scan, a CT scan, to get a picture of the bony anatomy. That's like an X-ray or a 3D X-ray.
Mm-hmm.
So one of the problems with CT is that it is, well, it's an extra scan, and it is made with X-ray radiation, harmful X-ray radiation. So what we've done is we've created an AI model that takes an MRI image as input, and we've trained it in such a way that it can produce a synthetic CT scan just by using the MRI input. So with that software, you just undergo an MRI exam, and you get 2 scans out of it, both the soft tissue and the bony structures, which can then be used for the rest of the workflow, for example, for surgeries. So yeah, it's a great product that is really using the cutting edge of AI in this area. To minimize the impact of these like scans on patients.
Yeah. And also I have been in an MRI scanner, not ever in a CT, but these are different devices, right? That would normally make these images. So that also logistically probably is a challenge if you.
Yeah, as a patient,
cost-wise, yeah.
As a patient, you normally have to come into the hospital twice, once for the MRI machine, book a new appointment for the CT scan. So there's 2 different workflows, and these images are then taken at different times, different body positioning. So also, if you want to compare the 2, they don't overlap straight away. Yeah. With the product that we create, you have just one exam, and these images are perfectly aligned to one another because well, they use the same input image. So you get two images that are perfectly aligned and can be taken throughout the rest of the workflow.
Yeah. And so, but they are still different images, or do you also like create like one sort of soft and hard tissue image for the doctors?
No, they are two different images, but the doctors use quite a lot of visualization tools, so they can load different images in the same like tool. So if they wanted to,
Oh yeah. Yeah. So their workflow is already adjusted to that.
yeah, and it's
Probably. Yeah.
yeah. So for their workflow, nothing really changes. That it's much faster and less burden for the patients,
Yeah.
and the doctor can just continue these. And what we've seen is that what we see as well is that because of the harmful radiation, these CT scans are often not made for pediatric patients. So for young
Mhm.
patients, children under the age of 18, the doctors think very carefully about ordering such a CT scan to be made, which is a shame because there's a lot of information in those images that can be useful for those patients. But because of the radiation, they want to minimize that. So either they get grainy CT images with low radiation, or they get no CT images whatsoever. So with our products, they can still get those images even without radiation.
Ah, yeah. Because obviously that radiation, that's not good. But like, what does that lead to if you would have that radiation? Because you said also specifically not for kids. So
Yeah, especially for so just a singular CT scan, that's not
yeah.
that's not a problem, and people should definitely have them if they need to. But on a population level, and if you have more and more of these CT scans throughout your life, there's quite a burden for these patients and a higher risk of cancer at a later age.
Okay.
Especially,
Yeah.
especially for children who undergo a lot of these CT scans. There's some published papers about this that, for example, scoliosis patients where the spine is completely deformed, if they have to undergo a lot of these CT scans year after year after year, they have like a 40% higher chance of getting cancer in a later age. So
Oh,
it's
wow.
quite an impact for these kind of patients.
Yeah. Well, then it sounds like a major benefit then to patients. So I guess that every surgeon and hospital wants to have this.
Um, Yes, there's been a lot of positive talk about the product, and we've rolled it out to a number of hospitals already, and we're in talks with others. Um, but with all of AI in healthcare, there's a hurdle to go over before it's being accepted in hospitals. So um, it's a difficult product to place on the market. You're not selling to consumers, but you're selling to hospitals. But we're doing a great job getting it into hospitals already.
Cool. Cool. Yeah. And you also mentioned sort of just now that sort of the focus seems to be on back surgery, and why specifically that type of surgery?
So the spine, everything from kind of your upper spine all the way to your pelvic
Mhm.
area uh, is one area that's often visualized with MRI and with CT. So that's a good area to go into. Other anatomies are also possible, like the shoulders and knees, but we don't have the data for that at the moment to train on. And those areas are a little bit less impactful for patients as well.
Yeah. I can imagine the spine is also, yeah, it's a very sensitive area, so I can imagine that indeed multiple scans there would have a bigger impact. Also, if you have cancer there, maybe that makes it, oh, that's probably a bigger issue than other places.
Yeah, and if you have a CT scan of your body, it's a bit different than a CT scan of your hand or your wrist.
Yeah.
There's a lot less radiation exposure.
Yeah, that also makes sense then. But yeah, you're not the only one who's playing around with AI. We also play around with AI. And so, as you know, we always have an AI generated dilemma.
Okay.
And you've already said that you are a nitpicker. We also found that information, so we fed it into our AI, being a stickler for the rules. So, if you had to choose, what would it be? You can get bone MRI accepted into all the major hospitals immediately, but you have to tell a white lie to get it done. Or you keep your integrity clean as a whistle, but adoption is painfully slow.
Oh, oh, that is a hard question, Jesse. Oh, um, if I had to really choose, um, I'd probably have to go for the first one, it being accepted with a white lie, with a reasoning, which is that
Of course.
in my job, there's always we always look at the risk benefit profile.
Yeah.
And with this, there might be like a risk or a downside, but the benefit will be a lot bigger. So, yeah, bending the rules of a white lie. Yeah, I might have to go for that. I'm not happy about it.
I am very happy I got you to sort of think
Yeah,
about that and go for this side of things. This is a a budding a budding politician here. Yeah. But yeah, like you said, there's extreme regulations, right? It's super strict, and obviously bending that is tricky. But how did you get your solution to be accepted? Because I mean, it uses AI. That is a tough deal. It's not deterministic. So how did you get it accepted into the healthcare industry?
yeah, like you say, it is very well regulated, and with good reason as well. So in the EU, the regulations have been updated a little while ago, 2016, and that was really on the back of some scandals within the health industry. For
Mhm.
example, with rupturing breast implants, that the safety regulations just weren't up to scratch there. So the regulations have really been made a bit stricter in that sense. Um, yeah, which is good. It's good that there are good rules to follow, because they do impact people's lives. So you need to make sure that they are safe and effective. And so it's a long process
Mhm.
to get to an approved product, and there's a few steps really that we've had to follow to make sure that our product has been accepted. And the main one there is making sure that your product performs as it should, that it's very effective at what it does, also that you have the evidence to support that. So it's not just doing AI experiments and seeing what the best performance of your product is. It's also getting real world evidence, clinical studies, using it in patients under controlled circumstances, getting the evidence from those clinical studies to show that, hey, if we do use it in our workflow, what is the outcome for the patient? And those clinical studies really are kind of the basis of getting that accepted.
Yeah, so I guess that's working together with doctors and hospitals, and having their patient groups use it, and then
Yeah,
outcomes of that, or
yeah,
how does it
absolutely.
work?
You work together. Yeah, we've worked together with a number of hospitals
Mhm.
where our synthetic CTs are compared with a normal CT, and experts, doctors, they look at the differences, look at how they would use it, look at the risks involved with using one over the other. And yeah, what you try to get is an outcome which basically says that it doesn't matter which one you use, the
Mhm.
further workflow for this doctor would still be the same.
Okay. Yeah, yeah, yeah. So it's basically it you're trying to prove, I guess, that it's exactly the same or better as what they're used to with a CT scan, except without the
Exactly.
downsides,
Yeah.
obviously.
Yeah, exactly.
Mm.
And then a second part of making sure that this is well accepted is that we do a whole risk analysis on our product. Yeah, you have to analyze what your product does, what your AI does, and make sure that you've analyzed all the things that can go wrong, or how it's used or how it's misused, and mitigate all those risks. So build in something in your product to stop those risks from happening.
Yeah.
And especially with AI, there's a huge number of AI specific risks that are important to analyze. So like you're talking about, for example, bias for gender, for age,
Yeah.
ethnicity. Also, we're talking about medical imaging. So the BMI of patients is a factor
Yeah.
that they need to consider, because images for small people look different than for larger people.
Never thought of that, but that makes a lot of sense.
Yeah, just little things like that are things you need to take into account when looking at bias.
Yeah, and then I guess it all comes down to sort of your sort of grooming the data, because if you want to train the algorithm, it has to have enough data for each of those variables along the whole spectrum, right? So I guess that's really tough to get the right data in. Then.
Yeah, and the quality of this data and the amount of data as well are really the driving bits of your AI. So you need to make sure you have good quality data, which tells you a lot, but also from a lot of different sources.
And
Uh,
does that mean that you start with sort of maybe a smaller target group, or sort of target patient that can use this, and then as you might over the years get more data, that you can sort of safely say like, well, now we can also you can also use it for these types of
yeah,
people.
yeah. So we've over the years, we've expanded our product a little bit with how it can be used. So in the past, we were only able to use it on adults, for example, because we didn't have enough data of adolescents to really say that it worked well. And there's different MRI scanner vendors, for example. You have like some big vendors like Siemens, Philips, GE, but all those different vendors have a slightly different output for their images.
Of course they do.
So, so you have to have data from each of those to make sure that you can really like show that you work on their product, on their scanners as well. So
Yeah.
in the past, we've not always been able to use all the images from all those vendors. So that's also something that you have to take into account.
Yeah.
And so in the end, what you
Wow.
want to do is provide validation data to say, hey, our product works for all of these vendors, all of these ages, all of these genders, ethnicity, and that you do that subgroup analysis on all of those groups to show, okay, we have a great performance over all of these.
Yeah. And as such, with like things like the European AI laws and regulations, and I'm assuming you are far better up to date about those than I am. But I guess that you have a major advantage in that, since it sounds very strict already what you have to prove right now. So I don't think that sort of sounds like maybe a watered down version.
Um, yes, so there are a few changes with the AI Act that come our way, but the majority of them we already implement because of the well-regulated healthcare field. So we've already thought about all the risks involved with our product. We've
Yeah.
already thought about um, all of these like AI risks, like bias, etc. So they don't come as a surprise to us because we've already been dealing with them.
Yeah.
But also, AI in healthcare is relatively new. It's only a few years ago that it really started expanding because it's such a long process to get a medical device
Oh, yeah, of
approved.
course. Yeah.
So AI is in healthcare is slightly like starting to catch up, which means that regulators now are also seeing which areas of the regulations they need to improve. So there's more and more AI regulations coming into place as well for us.
And is that only in the EU or also in
Also
other places?
in the rest of the world.
Okay. Yeah.
And a lot of it is also about, well, a lot of it is about cybersecurity, but also information that you provide to like patients or to doctors about what risks are still involved with your product, and also a bit about the explainability of your product.
Yeah.
Can you explain what your product does and why it does it? Because that's what the doctor will also need to be able to make informed decisions on how they use your product.
Yeah. Sort of like what maybe other sectors would call traceability. Like
Yeah,
you have to explain how you came from A to B,
yeah,
at
exactly.
least in a detailed way.
Yeah.
What do you think other companies can learn from your approach to regulations? Because it sounds like, yeah, like you said, you have sort of a head start on that. What are things that you can share that don't spill the beans on your specific IP, but
Oh,
would
no,
be good to know?
one of the things that we've done very well is we've documented our whole workflow for our AI training. That goes from data um, management, data collection, our model architecture, our pre-processing steps that we do on our data, but also our validation and performance metrics. We've written that all down in like workflows, and we follow those workflows every single time we do like a training, which might seem very strict, but it's a way to guarantee that time and time again you get the same output out of your workflow, out of your data processing
Yeah.
pipeline. So
Sounds a little bit like how McDonald's makes a hamburger. It doesn't matter where you do it, but it's the same thing,
yeah,
whether you like it or not. But
yeah,
it's a repeatable process, right?
exactly. And that repeatable process gives you the kind of the guarantee that you know what to expect at the end of the line, and it gives a very it gives you the confidence in your product that you are in control. And so I think the majority of companies already have such workflows in place, or they work according to those workflows, but they might not have written them down, and they might not have like all these procedures in place for all these processes in place. They already work according to what they think are best practices, but they haven't written them down and don't follow them time and time again. So that's probably something that I would start with. Write them down so that you have it on paper. And the moment you have it on paper, you start to realize, oh, maybe there's a gap here, or maybe we don't do this very well.
Okay,
You
good.
get confronted with your your
Yeah,
steps.
that sounds like a lot of work that, yeah, you have to sort of really start by doing that. And I think indeed companies that have like ISO certifications already have some things written down, so they might be at an advantage there.
Yeah. And
Um,
a second tip I would give is you should make sure that these workflows aren't written down by people like me, the regulatory officers. Uh, you want employees that work with him day to day to be able to follow them and not just follow them because I said so, but follow them because it's the easiest way to actually get to the end of the process.
Yeah, and then you check whether it also is a regulatory sort of compatibility or it covers all the spots that you need.
Yeah.
Okay. Clear. Thanks. As you know, every episode we also have a chain question. So last time we had Srini Rao on, with whom we talked about using AI for creative processes, and he had the following question for you.
Yeah, when it comes to healthcare in particular, my biggest concern, and I've always wondered about this, is like, how do you put in safeguards to prevent potentially, like catastrophic patient outcomes? Like, we don't want people dying because AI made a mistake. I think about this a lot because my sister's a doctor, so it's like, okay, yeah, there's some cases. So what I wonder is, like, how do you implement safeguards to address these issues?
Yeah, great question. Risk management really is a big part of medical devices in healthcare, and especially AI as well. So what we do is we have a very extensive process of finding out all the risks involved with our products. I touched upon that earlier as well, but what we do is we have a look and identify everything that can go wrong or anything that AI might miss, and we find out what the impact of that would be. What would the impact be on the patient? What could go wrong? Is it a catastrophic error, or could someone die if this happens? And what we then do is we try to reduce all of those risks by incorporating things in our design of the product, or by implementing warnings, or giving more information to the end user, to the doctor, on how to use our product. And all of these risks are then also discussed with experts, with doctors, to make sure that we understand very well what those risks are. So we have a lot of feedback sessions with people who use our product day in, day out, to make sure that we understand what these risks are and how we can reduce them.
Yeah.
And in the end, with products like ours, there's a lot more information that the doctor has than just our image. An MRI exam, for example, that a patient undergoes is not just one image that comes out, but there's about 4 or 5 different images that are taken in that same MRI exam. So the doctor has a lot of information available to them. And what we've seen in practice as well, if a doctor isn't sure about something, they'll always double check, and they'll reorder a scan, or they'll do some more examinations. So risk is definitely has a high priority when it comes to developing these products.
Yeah, that is very clear. Yeah, so you sort of take you also, it sounds like a little bit like you take a devil's advocate approach to some of the outcomes that might happen, and then work your way from there.
Yeah.
Cool. So that's all the questions that I have and that Srini have. But as I said, if you still have your questions, you can put them in the comments. We have a couple of them, so we'll go through them. And if you still have them, feel free to add them. Let's start with this one from Daniel, who asks, what are the current challenges of using your technology for different types of surgery, instead of only the back surgery or the spine surgery that we talked about?
Yeah, good question. Currently, one of the problems that we have is when it comes to patients that have already undergone some surgeries in the past. Some people have metal plates in their back or screws in their back. One of the problems with MR MRI images is that they're acquired using a big magnet, right? And so these metal plates, they show up as like voids in the images. There's just no data available from that spot on your spine. So there are some limitations that we're trying to like work around and see how AI can help do something with the limited information that is still there in the image. But that's sometimes a struggle that we see. And in the region where those screws are placed, you just can't get any information in our images. So then a CT scan is the only other possibility.
Yeah. There's a sort of a comment / question here. Thanks for sharing. It's very interesting. What a fascinating and much needed application of AI. Interesting point regarding how important the explainability of the technology is in the healthcare sector too. Not so much a question. I do think it's very interesting indeed. And like we talked about, I think it's very very helpful for the AI regulation as well.
But it's very and it's very interesting as well for doctors, and this is something that you see more and more when AI devices in healthcare are discussed, is that doctors want to know what the kind of the limits are, but also on what data you've trained or validated your product. What can and can't they see with your AI, and how should they use your AI in their workflow? And the more information you can provide to them, the better they can actually do their job.
Yeah, that ties in nicely with this next question, which asks by Anna, who asks, how do you convince skeptical doctors about your tech?
This is the interesting thing with our images sometimes is that it's hard to see the difference between a synthetic CT and a regular CT. So in the past, we've asked people to to say, hey, which is the synthetic one and which is the real one, and they're sometimes not able to see the difference. So that's quite interesting. But I would say that they'd have to have a look at the evidence. We provide a lot of clinical evidence, a lot of different research papers from groups, not even from clinical studies that we do, but a lot of different research groups in hospitals are writing papers about AI in general, but also specifically about our product. And there's more and more information about from the real world coming in to support like the use of these devices. And in the end, doctors need to start using it and see if it works for them, to see how they can provide the best care for their patients.
They can probably run it in parallel as well, right? Like run your software and regular CT just to sort of get a feel for it for a while.
And that's what we've done with a number of pilot studies as well in hospitals that were that wanted to implement it and wanted to see how it works in the workflow, run it in parallel, and after a while they stop using CTs and just only start using ours.
Yeah, and that ties in nicely with the last question that we have time for. That is by Peter. Like, can you share a success story of your technology? And not this one again.
Sometimes during a surgery, when the surgeon needs to reposition the body of the patient or needs to start, putting screws in the patient as well. They need to check the position of the patient or see basically how they navigate the surgery on the spine. That's often done with an operative CT scan as well, where they quickly make a CT scan during the surgery. There's a few vendors available that also offer radiation-free surgery with some tools, so navigation tools that don't use radiation during the operation. And those have recently started using our product as well.
Cool.
For a complete radiation-free workflow from start to finish. So that's been
amazing. Yeah.
Very, very nice. And we kind of see that as, a bit of the future where for a lot of cases, absolutely no radiation is needed anymore.
Yeah, that is a fantastic result. Thanks for sharing that. Yeah, that's all that we have time for today. The next episode will be live on the 10th of April, and we'll have Phil Laken on. Phil is the co-founder of No Code Ops, which is the first purpose-built ecosystem for ops professionals using no code. David, thanks for coming on. But as you know, we always ask you to have one question for the next guest. So your chain question, what is your question to Phil?
Phil, you run a community of operations people, and I assume they all or a majority of them use AI. My question is, how much talk is there about the upcoming AI Act within that community? Are people talking about it? Are they ignoring it? Curious.
Thanks for your question. I'm very curious to know. The ignoring part is also a way to handle it, I guess. Yeah.
Absolutely.
Okay, thanks. We'll ask Phil that question. David, thank you for being on the show. It was really interesting, I think.
Yeah, thanks for having me.
So make sure everyone to tune in on the 10th of April when I have Phil on. Thanks for tuning in today. If you like our show, please follow Trigger on LinkedIn or go to automationcaffeine.com. The show is also available as a podcast on all the major podcast channels. Thanks for tuning in, and see you next time.